I'm Tengu Muna with Achibo Clinical, and this is Clinical Trials Facts Wednesdays. We are delighted that you're here. At Achibo Clinical, we're passionate about two things: clinical trials and success mindset. Today, I want to talk about the entry-level jobs in clinical operations, and I'm speaking from the sponsor's perspective because that has been my experience in this industry for the past a little bit over 19 years now. Now, the first thing I want to say is that as someone who's looking to get into this industry at an entry level, the recommendation, at least my recommendation, is that you at least know what the industry is about. What is the clinical trials industry? What are clinical research sites? I mean, those are the basics. What do we do at clinical research sites? Why are we conducting clinical trials? What are the different phases? Who works at a clinical research site, and what is a protocol? Just the basics, right? And that has to do with the good clinical practices that govern the industry. And you really want to understand these we call them the GCPs. So the types of entry-level roles in the industry, and I'll also say don't be deceived by that because this is the highest paying industry. It's pharma after all. And those entry-level roles pay higher than most industries that I am aware of. So many of the startup positions are associate level positions. And what that means is that you are at a more of an administrative type level, but yet you're part of the clinical operations team and really managing. You could be an associate study, a study associate. And one of the reasons why I think this role is really crucial because it's one of the few roles where you are at the heart of the clinical research operations team. So you're privy to all the information that has to do with the day-to-day operations of the clinical trial. The reason why I'm saying this is because from this role, you can now move into so many different things. Something that I always say to the students or the clients that I'm coaching is if you're coming into this industry, you absolutely want to pick a role that allows for you to see all the different phases of operations, because as you rise higher and higher, and when you have to make certain decisions, you are aware of what operations is about, right? Versus not understanding how operations and execution occurs in trials, and you're making maybe a scientific decision when you don't have that information. So a study associate is a great one. A data manager associate, that's how I started my career. I was in data management, and really all the data that, it gets collected in the clinical trials. Obviously, we have to have a mechanism through which we capture that data. We have to make sure that, it's the protocol is being followed. And so we have to clean up the data, right? We have to ask questions if there's information that has been added that is not clear. We have to ask questions about it. And then before that, of course, we have to build a database, we impute all this data, and then of course there are other diff systems talking to the main source of data capture, which is typically electronic data capture, and we're capturing this on CRFs, or I would say eCRFs because it's electronic, or electronic case report forms. So I don't want to get into too much of the details, but just think about how important this role is because you are the center of all the data, you're managing it, you're resolving issues. You're seeing how the other data from all the other different systems are feeding into it, being transferred into it, and all of that stuff. So a data management associate is a really good one. I say biomarker associate or anything that has to do with labs. Majority of clinical trials, especially that are drug related, there's always a lab component to it. So it's really a great place to start where you can see how samples are being collected. You'll be exposed to sample management. Of course, this data management associate, biomarker associate, you're really looking at just one aspect of the trial, but it's still in operations. I think it's a good place to be. Another really good role is an entry-level clinical research associate. Clinical research monitors are the people who go out, and they might go out or not, so I will get into that. They typically will look at the data, look at all the essential documents, really make sure that at the level of the clinical research side, they are adhering to what the operations of the trial is. And then that's really what the clinical research monitor does. Basically, you just, making sure that everything is being done to ensure that patients are safe, that they have quality data, and that there's integrity across the running of the clinical trial. So it's a really good position because, again, you're at the center. This is actually a role. After I became a data manager, I moved on to become a clinical research associate, and then I started moving up. So these are some of the roles, but in a nutshell, they're usually associate positions that you can get into. But again, what my recommendation is that take some time of a training program or course where you understand the industry, where someone can actually break down this information. So that way, as you get into these roles, yes, there's a learning curve, but you're not going in cold, right? Like I did. I went in cold and it took me forever to figure out everything, so don't go in cold. Get the information, have someone mentor you, have someone train you, so that as soon as you get into the industry, you can just navigate and move up pretty quickly. And I always say knowledge is power. And so these are some of the entry-level positions. There are many others, but I've talked about the ones that are at the heart of clinical operations. Oh, there's one more role that I completely forgot about: regulatory associate. Essential documents are also at the core of clinical trials because they support all, the protocol and all the operations. So they are actually people whose sole responsibility is to manage the trial master file, or the TMF, where all the essential documents are being housed. So that's a really good role. And I actually have led a lot of the operations around, setting up the TMF, reconciling it, and all of that good stuff globally. And if you are in this role, that's a quick way to learn about a clinical trial, because you'll be exposed to all the documents in the trial. So to end here, my big takeaway is there's two things. Knowledge is power, right? Train, understand the industry before getting into it. The second thing is that you absolutely want to make sure that you get into a role that you're not stuck in, where you can move up pretty quickly. And so you want to get into a role that gives you access to all the operations around the clinical trial, because clinical operations touches, especially the study managers, we touch every single, or project managers, we touch every single aspect of the operations of the clinical trial. And so from there, you can actually decide what you actually want to move on to and do next. Okay, you guys, I hope that makes sense and that is helpful for those of you who are wanting to come into the industry. Now, make sure to join our WhatsApp group. Everything starts on the WhatsApp group. We have free resources on Facebook, and we also have a YouTube playlist where we have all these videos where you can learn. It's all free training, and it's actually curated for you. We have free webinars every month. Make sure to join that. Feel free to book a call with us as well. If you have additional questions, it's a free 15-minute call. So prepare for it, get your questions ready before it. And if you're interested in our clinical research training programs, click on the links below and join that as well. So all the links are listed below this video. Make sure to click on that. And again, be passionate, be full of integrity, and always rise to a higher level of excellence in your life. And I will see you on another Clinical Trials Facts Wednesday.